There's a surgical approach which helps remove all the tumor that can be identified. And then there's a radiation oncology approach, which uses radiation therapy to clean up some of the local tumor cells that weren't able to be seen to minimize chance of local recurrence. And the last step, I think a very important step, is the systemic therapy, which is where medical oncology comes into play. We help organize all the different treatments, make sure that you get all the different steps that you need, and provide the systemic therapies, which help clean up and get rid of any of the other tumor cells that might be throughout the whole body. So when speaking to those different treatment options, it depends on many different factors, but most importantly, boiling it down to the most simple components, the biology of the tumor and the stage of the tumor. So depending on the stage of the tumor, you can get systemic therapy before surgery, which is called neoadjuvant therapy. You can get systemic therapy after surgery, which is called adjuvant therapy. Or if there is evidence of the tumor being outside of the breast and other parts of the body, you go straight to systemic therapy, in which case you don't do the surgery beforehand. And there's also a preventative approach for if during the surgery they find certain types of breast tumors that have a higher risk of other types of breast cancer arising. You can have a preventative approach as another type of systemic therapy that's offered for these patients. Touching on a little bit of the biology of the cancer. So when you come see a medical oncologist, we really make sure we want to know who you are, your different medical issues, so we can make sure we give you the right type of therapies, and also the biology of your cancer. The treatment of breast cancer has evolved tremendously over the last several years to the point where it's not just the same chemotherapy given to every patient. We have much more sophisticated, targeted treatment approaches that we give to each of our patients. Not getting too stuck in the science, there's 3 major groups of patients based off the markers that we see. You have either ones that express hormone receptors on their surface, ones that have HER2 positivity, which is another marker for potential therapy that we can use, or you have none of those. You don't have any hormone receptors or HER2, which we call triple negative disease. Those 3 basic categories, among other different types that we see on the pathology reports, help guide which of the different systemic therapies we should be giving to each patient. The medical oncologists are very comfortable doing this. We do this every day, and it becomes second nature to us. So we're happy to sit down and talk about the specifics of your tumor, the biology of your tumor, and what would be the best treatment options, and work with you in your comfort and what you want and what's important to you to make sure that you get the best possible therapy based off of who you are as a patient and the biology of your tumor. Cancer can be a really scary diagnosis, and it's important to make sure that there's good communication with your care providers and the patients and their families. Along this journey, we want to be partners in this. Please make sure to communicate with us how you're doing with the different therapies. There's a lot of flexibility and ways we can adjust and tweak the different treatment regimens to your comfort and to better optimize your outcomes and how you tolerate the therapies.